97.9, 105.5, KISS FM. It's Liz and Big Papa. Big Papa is out today, but that's okay because I got people in the studio with me now, people to talk to. And it's the Slocum Dickson Medical Moment. It happens every first Wednesday of the month. And in studio, like always, is Adrian. Adrian, how are you doing today?
I'm good. How are you?
Doing fantastic. And when it comes to Slocum Dickson, SDMG.com, if you want to head to the website.
Right.
I go there all the time. They're my go-to. They're my doctors.
Oh, great.
And I got to say, there is physicians who are taking new patients. And if you don't have anyone to go to, you want to switch it up, I can tell you, Slocum Dickson is the way to go.
Yes, we have. So we had a bunch of new doctors join over the summer, and a lot of them have been on your show here.
Mm-hmm.
So as far as primary care, we still have Dr. Odua, who is taking new patients.
Yep.
And we recently had a neurologist join, Dr. Chiricuri, so he's open for new patients. And our new gastroenterologist as well, Dr. Jandir, as well as oncology, hematology, Dr. Dean. He joined a while ago, but he's still open too to taking new patients. So check out our website, sdmg.com. There really is a whole bunch of information. We just redid the site. It's
And it looks fantastic.
Yep, so hopefully really easy for patients to navigate through and find what they need.
It's really easy to pay a bill now, can I say?
Oh, good.
I like it from that aspect
That's
of it.
important too.
Yes, it is. It's always make sure that is the best part. And you also have new evening hours for your rehab center, right?
Yes, starting October 16th, we're happy to offer some evening hours for our patients for rehab. So it'll be open Monday through Thursday until 7 at night. So that's really nice if you're working. It's just so much more convenient. So
Really,
we're happy to do that. So that starts on October 16th. But, if you're looking to schedule an appointment, you can go ahead and call now for those dates as well.
Very, very cool. So do you want to introduce who you brought here today?
Yeah, so everybody knows October is big on breast cancer awareness.
Yes, it
So
is.
we are proud to have our breast cancer center at Slocum Dickson, and Dr. Cesare is here with us today to talk about how we can, stay healthy.
Stay healthy. I know. Hello. How are you doing today, Dr. Cesare?
Good morning.
Good morning. All right. So I am a 24-year-old female, and my question is, what can I do to help, either be prepared for breast cancer or make sure I'm checking for it? What is the best way to go about it?
Well, being so young, probably the first thing I can tell you is that self-examination is probably the best thing you can do.
Really?
At least at this age. Checking yourself. I usually tell my patients once a month. Usually, since it's so hard to remember how to do it and when to do it,
Yeah.
I tell my patients actually just do it the first of the month. And just when they're in the shower or putting on lotion or doing something, just feel the breast and check both sides and just be conscious that you're checking it. You don't have to go through, different maneuvers. Just
Right.
feel the breast, whichever is comfortable, whichever hand is easier, whichever technique, sitting up, laying down, standing up, it doesn't matter. And that's probably the best thing you can do for yourself. First off, younger women, we do suggest if you do feel something or question something, an ultrasound is probably the best.
It's probably the best way to go.
Diagnostic
Yeah.
tool. And it's certainly if we ever feel something, even in a young woman, then we proceed with more investigation like a mammogram. Today we use 3D mammogram instead of 2D or conventional mammograms.
Okay, yeah. Very, very cool. And I mean, obviously you do if you do feel something, immediately you should call you and go check it out in person, correct?
Well, that's the best thing to do.
Right.
Don't question it. Don't try to diagnose it yourself.
Don't Google it. Go in and get professional help because it's not something you want to mess around with. And what's new in the treatment of breast cancer?
Well, there's a lot of new things. Like I just mentioned, 3D mammogram is now probably the forefront as far as imaging. And it looks at different areas of the breast that are very dense and very thick. And sometimes we can detect things that we wouldn't have seen in the conventional mammogram or 2D mammogram. Other things that are probably more prominent and what people talk about a lot is genetic testing today. We test more and more patients today that have breast cancer, have a family history of breast cancer. And we're finding more genes that are related to breast cancer and things that we can certainly be more preventative or prophylactic treatments.
And I guess what factors put women in, greater risk for breast cancer?
Well, certainly all women are at risk.
Yes, right.
The incidence is 1 in 8 women. One thing to remember is that your risk increases with age. So even if you're young, there is a risk, and as you get older, the risk increases. It increases up to the age of 70. And then a lot of people think that the risk of breast cancer drops off at the age of 70. I've never had breast cancer. I'm fine. But actually the risk stays high and it actually creeps up a little bit all the way up until the end of life.
Wow. everyone always says that, oh, well, this is what causes cancer and this does it. And especially with breast cancer, it's such a well-known thing. I don't know. I just...
Right. So other things that put you at risk besides just being a woman.
Yeah.
Early menarche, started your menstrual periods at an early age.
Yeah.
Or have a late menopause. So your body is exposed to estrogen for long periods of time.
Oh, okay.
So those women are at higher risk.
At higher risk.
Women that have obviously a family history are at higher risk. Women that have a genetic mutation or genetic mutation in the family are at higher risk. So these are the things that we assess when we look at your risk factors.
And I mean, obviously, you guys are a part of making strides against breast cancer this year, correct?
Right. Yeah, we'll be participating in the walk. We are one of the major sponsors, and we've been for several years now.
Very cool.
And so we'll be there on the 15th, and we'll be walking. We have a rather large team. And
you have a team?
Proud to support.
Awesome. We're going to be on the course, so we'll be able to cheer you guys on, playing music and being a part and trying to make breast cancer as positive as possible as we try to find a cure, because that is the biggest thing. So thank you so much, Dr. Cesare, for coming in and giving me all that knowledge. And everybody, make sure you're heading over to sdmg.com, getting all the details about Slocum Dickson in general, whether you need a new doctor or whether you need to pay your bill. Whatever you have to do. It's the Slocum Dickson Medical Movement. Thank you guys so much for coming in.
You're very welcome.
And until next month.